Welcome everyone to another episode of the Tiny Loop podcast. Today, we're diving deep into a topic that affects millions of people worldwide, Parkinson's disease. To guide us through the intricacies of this condition, I have a very special guest, Dr. John, a renowned neurologist with decades of experience treating patients with Parkinson's. Dr. John, thank you so much for joining us today.
Thank you, Maya. It's a pleasure to be here.
Absolutely. Dr. John, for our listeners who might not be familiar, can you give us a basic overview of Parkinson's disease?
Certainly. Parkinson's is a neurodegenerative disorder that affects the part of the brain responsible for movement. It primarily disrupts the production of dopamine, a crucial neurotransmitter that helps control our motor functions.
That explains the tremors and stiffness often associated with Parkinson's. But are there other symptoms people might not know about?
Absolutely. Parkinson's can manifest in various ways. Some people experience difficulty with balance or coordination. Others might have problems with speech, swallowing, or even sleep. It's important to remember that Parkinson's progresses differently for everyone.
That's a good point. Now, what about the cause? Is there a known reason why people develop Parkinson's?
Unfortunately, the exact cause remains elusive. There's a complex interplay of genetic and environmental factors at play. Age is a significant risk factor, but it's not inevitable. Research is ongoing, and hopefully, we'll have a clearer picture soon.
While there's no cure yet, are there treatment options available to manage Parkinson's?
Fortunately, yes. Medication is the mainstay of treatment. Levodopa, which gets converted to dopamine in the brain, is often used. There are also surgical procedures for some patients in advanced stages. Physical therapy and occupational therapy are crucial for improving mobility and maintaining independence.
That's great to hear. Dr. John, what advice would you give to someone who suspects they might have Parkinson's?
Don't hesitate to see a doctor. Early diagnosis and intervention are essential for managing the condition effectively.
Absolutely. And on that note, Dr. John, thank you so much for sharing your expertise with us today. To our listeners, remember, knowledge is power.
Subscribe and follow the Tiny Loop to learn about science.